Well, everyone, I have 10:30. I'll call a meeting of the neighbors of Dunn County to order, the January meeting. Call of roll. Everyone is present. I guess Steve is trying to get on. Also, Chair Bartlett is with us. And everyone should have had a chance to look at the.
I think you're on the wrong
minutes.
meeting. Click on not the cool.
Are there any questions or concerns on the minutes?
Okay, if my meeting gets done, I'll stop over around.
In hearing none, is there a motion to approve the minutes?
So moved.
Is there a second? Motion's been made and second to approve the minutes and the December minutes. All those in favor say aye.
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 Opposed?
Mr. Chair?
Yes.
Uh,
Are you opposing?
Well,
Mike?
no, I'm not opposing. I just want to say thank you to Chris for making the minutes more inclusive, like we'd asked. I appreciate it very much. It was helpful.
Okay.
You're welcome.
Minutes have been approved. Do we have any public comment?
There's no public comment.
Okay, thank you, Krista. We'll go into Carmen's report.
Thank you, Mr. Chair. So as always, we start with Quality Assurance Steering Committee updates. This month we went over our pharmacy reports, which we do quarterly. They get sent to us from our contracted pharmacy. It's a little bit different than before COVID, as our pharmacists do everything remotely now, but they still do the same checks and reviews of our medications as they would do if they were in person. It is just all remote. But we went over our pharmacy reports. There's nothing alarming in that. And then we went over our normal reports. And then the only other thing that was outside of the norm was we did have a past non-compliance for our life safety code checks. So we missed a couple of fire drills. That was just because we accidentally did them in the wrong building. In December, they should have been done in Central and they were done in East instead. And then January was supposed to be East. So we corrected the mistake, ran January for both Central and East. So we weren't off track going forward, and then wrote a past non-compliance as well. So when survey does come, when they review things like that, we can show that we caught the mistake and corrected it ourselves. Typically, at least on the health side, that does tend to result in not getting a citation if we corrected it ourselves. I don't know necessarily on the life safety code side, because typically past non-compliances are more common in the health side of things. So it could potentially prevent a citation. Otherwise, it is just a minor citation when you have an error like that. So, but we did correct it and are set on track for the rest of the year as well. Any questions on quality assurance? Okay, move on to the employment activity report, and I'll have Chris do that.
Morning. So I had sent this out after the whole packet had went out, but everybody should have received it. So for the month of December, very few applications were turned in. And across the board with other recruitment, hiring people in long-term care, we're not, alone in that. Obviously, I'm sure part of that's the pandemic, driving some of the applications that healthcare isn't real attractive to work in during a pandemic. So what we had for the amount of interviews scheduled was 3. We held 3 interviews. We offered 3 positions. And 2 of them were accepted. 1 was declined because of pay, and that was a nurse. They actually all had 2021 hire dates because that was kind of the tail end of December. So with that, we had 4 resignations. We had a LPN that had graduated as an RN. She accepted employment with Mayo. And then we had a couple of part-time CNAs went to Mayo. And then we had a part-time homemaker who was on a leave of absence. She was a probationary employee, and her leave of absence wasn't able to be extended, and she wasn't able to come back. So if we go down to open positions, those were adjusted with the hirings and people leaving. So we're still, have quite a few empty CNA positions that are filled with pool. I can speak to pool a little bit. Paula and I had a couple of interviews earlier in the week, late last week, earlier in the week. We thought we had both of them secured because some of our agency staff are not renewing their contracts. And those both had backed out. So kind of a little scary on the agency front as well sometimes. What's that?
For nurse wise too, though.
Wants to kind of speak to.
I was gonna say too, nurse wise, for agency, even our own, we haven't been able to secure any nurses. We're actually still down quite a few open positions, and that's part of the reason why we can't get too many into central admissions, because we don't have the staff. We had an LPN that had worked here previously as an agency CNA and called to wonder if we needed help. And I said, yeah, we would be happy to have her come back. But she wanted $50 an hour, and that was her pay. That is not what agency would have to charge. I said, there's no way that we can do that. That's more than any of us make here. And then we had an RN that wanted to come back to work, but he actually got offered more money at his own place to stay because people are chasing the COVID rates. So I have not gotten an RN or LPN interview for quite some time.
Through agency.
Through agency.
Right. Okay, back to me. Switch my webcam back this way. So then we go down to the leaves of absences. We still have a number of students out. As far as other leaves, though, it's not a terrible amount. At a homemaker that's out, that leave has since ended. A couple of CNAs, one CNA on a military leave, sorry, and a food service worker, full-time, was out on FMLA. As far as work comp goes, we did have a little bit of an uptick in work comp missed hours, not huge, but there was a few. And if we go down to the red highlighted on the form, there was about 60 shifts missed due to COVID-19 issues. That was either from a person being, I don't think we had a positive, but we had some exposures during that time period. And then that would have been roughly about 480 hours, give or take a little bit. So.
Any questions?
Have any
for Chris?
questions on that, or?
Okay. So next,
Yes.
we
Dave, you
move-
have a question?
Well, I guess, you're mentioning that it's hard to get help, or that you're not even getting anybody to apply or anything. At what point does it become something that we really better start worrying about?
So I think there's a couple of things here. When it comes to the census and central, we haven't had as much of a drive for need for staff at this point because we weren't able to accept. But now that we can accept, we might be getting to the point that it's going to be more drastic. As far as the agency staffing wise, I don't know if at any point we would be able to meet the $50 per the LPN is higher than what we pay the RNs through agency. So the other issue with that is then if we hire people at that rate coming in, people talk. And then that's going to be what the expectation will be for everybody else as well. So I'm not really sure how we are going to meet that need for the agency staff. As far as our own nursing wages, that is something that we think that we should talk about and potentially look at doing like a wage analysis across the board for local staffing wise, especially for our RNs would be our greatest concern for staffing wise. Our CNAs are extremely competitive staff or wage wise in our area, but the nurses are starting to fall behind other places in our area.
So I guess that's why I brought it up. We should be starting to do something now instead of wait until we're completely in trouble.
Mhm. Yeah, so we can work with Heather and the HR team on that and see about wage analysis in our area, and then have something to be presented next month as a potential of what we could or couldn't increase. I know what has been discussed in the past that was an issue in regards to wages for our staff nurses or RNs is that we require only a 2-year degree, and public health's RNs require a 4-year degree. So there had to be some distinguishing between the two, was something that had been discussed in the past. This is all secondhand. This was prior to when I started here, but that was part of why they were lower than the public health nurses. So I don't know if raising our nurses' wages would also then have to pull public health in there too to raise theirs, since theirs has a different qualification than ours do.
Mr. Chair,
Yes, Mike.
in line with what Dave said, we shouldn't wait. I know there's lots going on in the state and everything, but Chairman Bartlett has mentioned in the past that the biggest one is still the CNAs. And I know you started looking at that, and then the COVID came along. But like what we just said, perhaps now is the time to really start seeing what we can do in that area too, training and things that we talked about before. But yeah,
So-
waiting.
Yeah, we did attempt to do the training program for CNAs and everything, and got nowhere with the state on that. So they're doing emergency training programs and things like that. But we can reach out to the state again on the possibility of doing CNA courses here, because we did do the application process for that and didn't really get anywhere with them with that. So I don't know if they have put those on hold necessarily because of everything else. I'm not 100% sure on why we didn't hear back from them for the CNA portion of that, but we can try that again as well.
Yeah, that would be great. But I understand lots going on. But yeah, the first come, first serve maybe, if we keep bugging them. Thank you.
Any other questions on employment? All right, next we'll go to the resident referral report. So this looks similar to as it did in the last couple of months, which I'm happy to say should look better in January, as all 3 buildings are currently able to accept admissions. But for the majority of December, the central building was not. We did admit some to the outer buildings when we had open beds, and we will have a higher Medicare census in the outer buildings than typical, because we did admit to them instead of central when we couldn't. But for number of residents and house at the beginning of the month was 105. We had 59 referrals to the neighbors throughout the month. We admitted 10 residents and 49 were not admitted. 3 people had positive COVID infections, active COVID infections. 7 went to their first choice, 3 being swing bed and 4 being facilities closer to the family. We are seeing a lot of referrals come from farther away, because hospitals are required to keep referring until they find a place to accept that will accept the resident or patient at that point. And then the people that are actually there are hoping that the buildings that are closer to them will be able to accept shortly. So say someone in Rochester, that's family lives in Rochester, all the nursing homes there are currently in an outbreak. They'll refer to us in the meantime. We will typically deny because either we're in an outbreak or they want to be closer to home, or they won't actually want to come to us because we're too far. And then they wait until one of the buildings that's closer to home is able to admit. So we're seeing a lot of referrals that are from further away. So we had 4 of those this month. There was 1 that was out of network insurance. We had 17 with severe behavioral health or AODA issues. We had 3 that expired at the hospital, 13 that went home. We're seeing that trend still pretty high of people deciding to go home instead of into skilled nursing facilities. Primarily visitation is a big part of that. Quarantining is a big part of that. And then also safety. Congregate living is obviously a more likely position that people would be in to spread COVID. So it's safer to go home. And then 5 did not have a payer source. At the end of the month, we had 103 residents. We had 0 residents transferred to other facilities. We had 4 deaths and we had 8 discharged home. Like I said, we are now able to admit to Central. We were able to admit starting on Tuesday of this week. So we have started to get more people in. We are up to 106 today. So we're trying to fill the building back up. Any questions on referrals? Okay. And next we'll go to the environmental report with Scott.
Good morning, everyone.
Morning.
Things have been going fairly smooth. We had turnover of express custodian, gal that we had working for us, called in one Monday. She had slipped over the weekend on some ice and hurt herself. And then by the time the express was asking for a doctor's excuse or doctor slip from her, she decided that she did not want to return to work. So we recruited for another employee, and Express phoned us a guy. He started with us, I think it was January 7th started, and he is working out very good. The bad thing is that he is works for a landscaper during the summertime, so he is with us short term, which is unfortunate because he's a very good worker. So we'll be, once he's going to go, we'll be recruiting for another replacement for custodian. Been working through any of the issues with the geo system. The repair guy that we have been having come in and work on the system is out of Rice Lake, docile geothermal systems. He's very knowledgeable on the geothermal systems, giving us more insight on things to look for, ways we can diagnose problems ourselves, and what we can look for. He's been a very, very good help to us. We'll continue working with him to get some more knowledge of the system and what makes it work better so that we can have less problems with the heat pumps. We just had a few minor problems, an area that resident room that is cold, check into it and see what we need to do. And we've had less issues. We did put a couple of lock boxes on thermostats where residents have been pushing buttons and staff have been pushing buttons. Try to curb that a bit to keep things working better and more consistent. We had we reported before that we did an update on the server for the nurse call system. With that update has been some issues we've been working with RF Technologies on getting things straightened out there. It seems to be getting less problems on that lately. Other than that, the guys have been working through the work orders and just keeping the place running. Custodians been keeping it looking good. Lack of snow has helped out where we're able to do that stuff, not being out spending as much time moving the snow. Guess that is all for me. Any questions? Thank you.
Thanks, Scott.
All right. So next is vaccine administration. So the Neighbors is really happy to share that we received our first round of the Moderna vaccine on the 4th of January. So we had 183 individuals receive the vaccine. It was about 50% of staff and 90% of our residents received the vaccine. We are hoping that on our second vaccination that we will have a higher percentage of our staff. We're hoping that we can get up to 70%. I do know a lot of people were nervous about it, and maybe seeing that everything went smoothly and was okay, that more people would be willing to accept the vaccine the second time around. Our second vaccination clinic will be on the 1st of February. And then we'll have a third vaccination clinic on the 1st of March to catch up anybody who didn't receive their first vaccine the first time and need their second one, or missed the second one, just to kind of clean up anyone who needs their second dose. So the vaccine clinic went extremely smoothly. We had Walgreens on site. They arrived about 8 a.m. They came and they were here until about 5:30 p.m. They started vaccinating around 9 a.m. and they started in the West building. We vaccinated all of the West residents. Took about an hour and a half to 2 hours. And then we went over to the East building, vaccinated all of the East residents. The second building went much quicker. It was just over an hour. So that went very fast. And then we came to the Central building, vaccinated the Central residents, and then started doing all staff. So we had all the staff come to the Central building so that it could all be done in a bigger group. We vaccinated out of Arrowhead, where we currently don't have any residents. It was also fortunate that we had our clinic on a Monday, and all of our clinics will be on Mondays, so that it is also a testing day. So we had everyone get tested first and then go get in line to get vaccinated. So then it was one smooth thing and caught everyone for both things. Walgreens was very easy and nice to work with. We had one-page forms that had to be filled out. Basically insurance information, certifying that we were 18 years of age, and then any questions about how we're currently feeling, if we were had COVID in the last 14 days or anything that might exempt you from getting the shot. The process itself took about 3 minutes. You filled out the paperwork, gave it to the Walgreens people, they scanned your insurance information, and then you had a shot administered and you were done. After that, after that, you had to be monitored for 15 minutes. So that was probably our hardest thing. It was very, very fast to get people through the actual shot clinic. But then when you're having to be monitored, there was not enough space to keep everybody spread out and everything. So that was a little bit difficult, especially in the staff situations for the residents. We had X's on the floors where we would have them go and sit for their 15 minutes and then sent them back to their rooms. But when we had a multitude of staff going through the clinic, keeping everybody spaced out down in Arrowhead was a little difficult, but we made it work. And we had 5 pharmacists and 2 pharmacy techs there from Walgreens. And like I said, they did a fantastic job and were super easy to work with. So it went much better than we had anticipated. We were all a little bit nervous about that, but it went very well. After vaccinations, we only had a couple of staff have mild reactions. We had no severe reactions and no allergic reactions. It was normal vaccine reactions. Reactions to a vaccine is actually a good thing. With the exception of allergic reactions, those are not the best, but reactions to the vaccine in your body after a little bit of time is a good thing. It means that your body is forming an immune response and actually trying to fight off the vaccine. It is a good thing saying that you are actually building immunity to the virus. So having a reaction isn't always bad. We did have, I believe, 3 staff that had any sort of reaction more than just arm pain. Almost all staff reported arm pain. similar to and a little more than a typical flu shot. And then we had a couple staff that felt under the weather, but that went away after about 72 hours. So no severe reactions at all, and everybody is just fine. There has been some statistics on that the second vaccine does have a higher chance of causing a more severe reaction, which would make sense because your body is then creating a better immune response as well. And we did see people that had previously had COVID having stronger reactions to it, which would also make sense since they do already have some immunity in their system as well. Do you have any questions on vaccines?
I have a question, Carmen. I didn't realize you couldn't get it if you had the COVID at the time.
Yep, so you
Is there a
have
reason?
to, yeah, you have to be 14 days out of having COVID. So you can't be in your infectious period. There's a couple other things too, like you can't have had other vaccines within that 14 days also. So for example, we did have one resident who didn't receive the vaccine that wanted it because he had recently had a shingles shot. So things like that, there's some things that do bar you from having it. He will get it, his first shot on our next vaccine clinic on the 1st of February. So, but there are some things that do bar you from getting it.
So you feel as if you'll have some more of the employees they're just waiting and seeing if somebody else got sick first, huh?
I do think we'll have more. I think there's more information out about it. They can see that all of us are just fine. We didn't have any severe reactions. I think there is a lot of fear in receiving the vaccine, which is understandable, but there's also a lot of benefit to it too. And I think people are seeing less fear after people that are, quote, the guinea pigs received it first. So, and all of us are just fine. We're strongly encouraging it for all staff, and then also trying to strongly encourage it for everybody once they're able to get it. Our biggest selling point is we want our residents to be able to see their families. The more people that get it, the sooner, the more likely that's going to be. So we've been trying really hard to convince everyone who can get it to get it. Any other questions for me on vaccines?
I have a question, Carmen.
Sure.
I was wondering if you have to have a test first before you get the shot to make sure that you don't have it?
So that isn't specifically required. We did that just because it was on the same day as our testing day and it kind of kept the flow going. So we did a rapid test and then our PCR test like we've been doing for our testing day. So we would have known if someone had COVID right away and we could have sent them home and not had them receive the vaccine. But it's not, I don't think it's inherently required like by Walgreens or the CDC or anything like that. It just kind of worked out that way for us. Any other vaccine questions? All right, and then I'll move on to COVID in general, I guess. So vaccines has been the primary focus in the last couple of weeks as it has been the good step in the right direction, and we've put a lot of focus on that. But we still are dealing with the effects of COVID prior to vaccine and in general here at the Neighbors. So we did have 2 staff members test positive this month, actually the day of the vaccine administration. So we were in an outbreak in Central. We had no residents test positive, and now we have cleared that outbreak in terms of admission and testing for residents and everything like that. Public Health will still have us in an outbreak on their records for, well, now it's less than 14 days, but their total is 28 days. Ours is 14. So our 14th day was Monday. So we were out of it as of Tuesday, and that's why we were able to accept admissions. Our other 2 buildings have not had any positive cases for quite some time. East's last positive case was November 24th. West was way back at the beginning of November. We are doing pretty well for COVID in general. Their cases have slowed down. We have seen a lot of people out due to being close contacts still. Lots of families. That's been our biggest thing recently is kids having COVID and their parents are our employees and they have been out for longer periods of time, especially if they're younger children because they cannot separate from them. And then their 14-day quarantine starts at the last day of infection for the child. So typically it's about 24 days. We've even seen some staff members that one child has it, the parent doesn't have it, but then another child gets it. So then it also extends even further. So that's what we have seen recently, as well as it's been great that we have had less staff testing positive, but we have also had a lot of people out quarantining due to close contacts. We've also seen, I believe, an increase in the close contacts because there has been lower rates, vaccine coming out, all of these positive things. I think people are getting a little bit complacent in behaviors outside of work, such as going to get-togethers or out in public and things like that. So I think that is widespread, and it's not necessarily just staff here, but in general in the community, people are out doing things more because it has gotten better. But unfortunately, that might just turn us right back around in the opposite direction. So we are stressing to continue doing all the non-pharmaceutical interventions, even after vaccine, as it is not proven yet if you can transmit the virus or not, even after you're vaccinated. You might not get sick, but you may be able to spread it still. So that's another worry that we do have. We are fortunate that the majority of our residents chose to get the vaccine. So hopefully if someone was still able to spread, no residents would get sick from it, but it is still a possibility. Anyone have any COVID questions for me?
Do the residents wear masks, Carmen?
If they tolerate it, yes. We do have a lot of residents that take them off. We do have some residents that's families specifically requested us not put masks on them. But if they're out in the general area, like in the dining rooms or hallways, we do ask that people have masks on unless they have a specific order from a doctor, or if a family asks us not to have masks on them, and then that is documented in their chart. And then when staff enter the room, we do also try to have residents have a mask or some sort of face covering when staff enter the room as well. That has been a little bit more challenging because they're in their own room. They don't want to have a mask on, and they don't have to have them on if there's not others in there, but trying to prevent any contact as best as possible.
Are they eating their meals in their own rooms yet?
Yes, we do have everyone in their rooms as much as possible. We do have some individuals that need to be monitored while they're eating, and then we have them out in the dining room, but they are at their own tables if they are out in the dining room. Any other COVID questions? All right. Census and case mix. As I reported, we have today's census is 106, so we are going up. We obviously have had a fairly significant dip in the last few months, which is not new news. We have been able to keep the outer buildings fairly full. We did have quite a few deaths in the last couple of months. We did have a couple of deaths due to COVID, and then the other deaths that are coming that had just happened. But we were able to fill some of those beds in the outer buildings. And then obviously Central has been very low due to our admission hold because of COVID, but we are starting to fill those rooms up again. It is a tricky process, as whenever a new admission comes in, they are on a 14-day quarantine, which means we treat them as if they could be COVID positive, which means gowning, taking off your regular PPE, putting on different PPE, and doing all of that every time you enter the room. So that does take added staff time as well. So we try to stagger admissions so that we don't have 10 people on isolation in one household, causing extra time needed for staff as well as staffing constraints in general. Any census questions for me? Right. Is there any other questions that anyone has for me?
Chairman
Mike?
Johnson, it's not a question. I just want to compliment the newsletter and the information you have in there. It's been nice, easy to read, and informative. Nice job.
Thank you. Any other questions?
If there are no other questions, thank you, Carmen, for your report. We'll get into the vouchers. Anyone have any questions on the vouchers? Comments?
It's me
Yes,
again.
That's fine.
I have a question. I saw advertisement 3 different times for 4,000. I'm just curious what the advertisement's for.
Just give me 1 second. I'm just looking for which one it is. So that might have been something that got posted for the, oh, actually, I know what that one is. So that is the Blue Group's bill for the year. So that gets, we get 1 bill for the whole year. They do our, like the newsletter, our website, all of those, anything that comes out electronically is Blue Group. So we get 1 invoice for the whole year, and it's on there 3 times because we split it between the 3 buildings. So that goes for, it's a third of their overall yearly cost goes to each building.
Thank you.
Any other questions on the vouchers? And hearing none, we'll go into the financial report with Jane.
Hello, board. I'm glad to be here one more month. The financials. If you turn to the, well, usually we go to the pool staff and aging first. So we go to the aging report. We are at 1.236 thousand. So 1 million, down almost in half of what it was when I first started. So we're still holding on. We went down a little bit again from November to December. We're at that point where we can't get much lower. However, there are a few items in that bucket of 180 days and older. Those are, some of them could be potential write-offs, some are payment plans, and some are claims that are just hung up. But we're monitoring all of those. The VA has pretty much been caught up with the exception of some of these old things. So we're still making progress on the middle groups, the 61 to 180 days is down at 8% of our aging, which is just where it needs to be. So that's really good news, good way to end the year. And we want most of it to be in that first top bucket of current billing. So that's the good news on that. The pool staff. We do have year-end numbers. The total ended up to be just over 2 million. There's a few more vouchers coming in. I can get the detailed comparison that you asked for probably in March after we close out our books and we make sure we've counted all the hours and can compare apples to apples for that. How much, the question always was, how much does pool staff cost as compared to the direct hires? So that hasn't been forgotten. I will get that done. Questions on the pool staff total? Then to the financials. Sorry about that. I've got my packet stapled. At the top of that first page, the income statement for the campus, the year-to-date occupancy rate ended up to be 87% compared to budget of 88. So Carmen was able to keep that percentage high enough that we came really, really close to budget. Mainly due to the east and west being open when the central was not able to take admissions. That really saved the day, having 3 different facilities to choose from during COVID here. If we go to the COVID payments received, we did receive $254,000 additional in December from miscellaneous COVID. Some of it was the incentive, the quality incentive, because we were able to take patients from hospitals. That was $2,900 per patient admitted during September, October. I don't think we'll get money for the November, and perhaps in December we'll get a little bit, and that would be paid out in January or February. So there might be a little bit more coming. The actual year-to-date COVID money received is $1.4 million, and that will be offsetting our expenses that are embedded in the lines below, and also against some staffing costs that haven't really been adjusted because we have to keep the staffing general ledger accounts where they are. We can't just move those around. So that'll take a little bit more finesse. End of the year, we've come in at about $206,000 more in revenue than we anticipated if you take out the COVID money. So we really don't have a loss in revenue due to COVID when you take it as a campus. And that's how we need to report that to the COVID federal reporting sites. So I'll still look at how we can compare budget to budget, year to year, and see if we can claim some lost revenue a different way. But based on these numbers, we didn't see lost revenue compared to budget. On the expenses side, the administration line came in at $265,000 over budget. That is where the write-offs are housed, and that was about $253,000 of write-offs that we had this year due to old write-offs that weren't completed before I came. They're like 2017 and 2018 accounts, and then some timely filing and some other miscellaneous. But that's why that number is off compared to budget. Nursing, of course, that's the temporary staff, the pool staff. MDS, we have the MDS nurses working as nurses also on the floor. So those wages are all nursing wages. Life enhancement, you'll see that's $18,000 off in that department. They did staff up a little bit, and that would be balanced out with COVID funds because we do have staffing money available to balance that out. Everything else looks pretty much in line. The depreciation is in there. At the end of the day, the net income is $798,000. That's with the COVID money and with the COVID expenses. However, the reality is we lost about $500,000 due to expenses, some increased COVID expenses that hasn't been adjusted for. And some of that COVID money will be carried over till next year. So cash-wise, it looks like we came in pretty close. We didn't cover the depreciation, which is always the goal, if you balance out those numbers.
Jane,
Yep.
you say some of this COVID money that's in here now will be carried over in 2021 or more to come?
Both.
Okay. Well,
Um,
yeah.
Yep. We're, Carmen and I work every month to see where I need to track different expenses. For example, dietary. I just asked Marcia to reach out to Reinhardt. They can run reports on what our increased cost is for food cost due to COVID. They can run, if a case of apples used to be this much and now it's more, they can give us that data and we can apply this money towards, food cost and through PPE, extra PPE. And we've tracked what's normal versus what's increased. So the devil's in the details, but the feds are letting us track our expenses through June 30th, our COVID expenses. And it looks like the expense is going to continue because COVID hasn't gone away yet. So what we don't use this year and can't claim against it, will carry over. And then if we need to refund any money, we would do that July or August of 2021.
Okay, thank you.
Mhm.
Brian?
Yes, Mike. Go ahead.
Yeah, thank you, Jane. Now, what exactly does that 798,229 mean for us? Is that money that we actually have over and above, or is that just on paper? It
I would
doesn't go back
say
into a general.
no, that would not go back into the general fund. That's COVID money that made it an excess. So we're really holding that extra revenue, if you can call it revenue, it's really meant to offset our expenses. We haven't taken out, like Carmen's wages will, a fair percentage of those will be offset by COVID dollars. So some of that will offset our regular costs. And we'll get to that, I would think, at the end of next month when we really have to finalize our December and year-end totals. But yes, some of that we will keep. I don't see that. I would think maybe $300,000 we would keep. So if you add that into the 500 negative, we're not nearly as negative as it appears. And then cash wise versus on paper, I think on paper we'll have maybe a $200,000 loss, and cash wise probably no loss. If that makes
Thank
any
you.
sense to you.
I'll keep asking, and it'll eventually sink in.
Yep.
Keith?
Mr. Chair, thank you. Just to also clarify or reinforce, these are just the preliminary year-end numbers. There still is a lot of work reconciling, preparing for audit and closing the books. So this is just kind of the raw data as it sits as of putting this together late last week. There will be a number of adjustments for those of you that have been on the board or the committee for a number of years. Yeah, this is just the first blush of it. When we report out on the audit will be the first week of March. And, so you'll see numbers change here, especially this year, potentially significantly, because those COVID dollars, the accounting standards are still being set. And we still have to work through all of the changing guidance on what we can record and report now versus 2021. So there will be some changes as we go. I just wanted to, make that point to everybody. Just be aware that this is not anywhere close to the final result.
My question to the board then is, do you, like next month, would you like a report on how we've applied COVID dollars to our expenses?
I think that would be an excellent idea, yeah.
Okay.
Do you have more for us, Jane?
Oh, no, I don't. That completes my report. I'm sorry.
No, that's fine. That's fine. There are no questions on the vouchers. No other questions for Jane. Is there a motion to approve the vouchers and the financial report? Don't all speak at once.
So moved.
Kelly is moved. Mike is second. Although, any other questions? And hearing none, all those in favor of approving the vouchers and financial reports signify by saying aye.
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 Opposed? Carried. Okay, does anyone have anything else that they want to bring up? And hearing not, we are adjourned. Everyone have a good day.
Bye all.
See y'all next time.
Thank you.